Hi, it's Dr. Centeno, and this is the How to Rehab from CCI series, part 3. Now, this is for limited patients. We have videos for patients who are more functionally disabled than this, and we have videos for patients who are less functionally able than this. So I want you to like, comment, share, and subscribe, because if you're a patient who has CCI, you probably just found this stuff, right? Now, in order to make sure other patients can find this kind of stuff, one way you can pay it forward to the CCI community at large is to do these things, because that's how they can find this stuff as well. So this is a 3-part series. We started out with threading the needle, how to balance rehabbing versus flare-ups, and then we went on to rehab strategies, the kind of things that you might want to consider doing to rehab. And now we're at matching your functional level. Now here we're focused on the limited functional level. So that means you can spend all day upright. You can significantly limit what you do to manage symptoms, but it means you kind of live in a box, right? You've created this box, and if you don't do A, B, C, D, E, F, and G, you're good, and you can be somewhat functional. But if you do those things, you're going to pay for it. So this is what we call a limited functional level. So let's go into what all of this looks like. I call rehab in general for CCI patients climbing out of the hole. Now, if you're functional or mostly functional, the hole's not very deep. It's not that hard to rehab. If you are, however, limited, very limited, or bedbound, it can take a long time to rehab, and you might need help interventions like posterior injections, PICL, to help you along the way. Really, any of these functional levels can require that, but the more limited ones more so. Now, this thread the needle concept, I talked about it in the first video. This instead is more of a different look at it, right? You start with the level of disability. In this case, you're limited functionally, and you try something. I call that a rehab strategy. And if your symptoms are manageable, then you should be able to increase the difficulty of that strategy and eventually get to the next functional level. But some patients won't be able to tolerate that, right? It'll make their symptoms unmanageable. So they've got two options. One is to back up and try something much easier. The other is that no matter what happens, you're just not going to get to move forward, in which case you really need some sort of CCI intervention, something like a PICL procedure or a posterior injection. And obviously the goal would be to move forward with all of this stuff and get to the next functional level video. So in limited patients, the overarching goal for rehab is to do more without flaring your symptoms. So many patients, when they started, if you started at bedbound, for example, using a collar was needed to get out of bed and be somewhat functional. Here, the focus is a little different. If you're using a collar, it should really only be for specific instances like riding in a car, traveling, etc., and certainly not more than an hour a day. If you're using it for more than an hour a day to achieve this level of functional ability, then you got to start weaning that a few minutes a day. Now, what if you can't do that? You can't wean out of the collar no matter what you do. Well, then you may need an intervention like a posterior injection or a PICL. What if you don't use a collar at all? I've never even tried one. Well, try one, because a lot of our CCI patients actually find a collar useful, but don't get dependent on it, because collars can make the muscles very weak. So you only want to use them when you really, really need to. And then we've got muscular instability and proprioception. So instability as a concept has a ligament component. The ligaments are damaged, so things move too much. And it's got a muscular component. And that muscular component, literally the muscles are what actively protect you. So in this case, muscular instability is also kind of mixed up with proprioception or position sense. So that's why we have these laser exercises online, and you can march through them. You can start in level 1 and then go to level 2, 3, and 4. Now, if these make your symptoms unmanageable, then stop. And if you can't tolerate this at all, you can't really move forward, then you may need something like a posterior injection or a PICL. Now, if you can get through these exercises, then your next step is to try to get a physical therapist who can help you get more functional. So again, muscular instability and proprioception is one component. Now another component is what we call symptomatic structures, right? There are things in your neck, facet joints, nerves, vessels that are causing symptoms, and there are things you can do to mitigate those symptoms. So for example, this is how OA or NUCA chiropractic works. By correcting that relationship between C1 and C2, they can take pressure off of those irritated facet joints and maybe give them a chance to heal. They can take pressure off those irritated nerves and give those a chance to calm down. Now, if you can't tolerate this, then again, you might need an intervention like a posterior injection or a PICL. Another thing to consider is pressure in the back of the skull. Some patients like ice as well. But pressure in the back of the skull usually provides some relief of headache pain. If that causes headache pain, then maybe consider icing the back of the skull and those suboccipital muscles. But that also tells you that those structures, the occipital nerves, are probably causing your headache. And those may need to be directly treated if you can't rehab yourself out of this. Another thing to consider adding at this level may be something like a Theracane, and that can help to provide some self strategies where you can find the trigger points and work them out yourself without having to go in to see a provider. And then curve is a big deal for many of our CCI patients. You know, if you have a loss of cervical lordosis or the normal neck curve, you can try this towel test, and that's where you take a hand towel, you roll it up, you put it back here as shown. And if that makes things feel good, then you might consider trying more formal chiropractic biophysics or CBP. You can find those practitioners at idealspine.com. But if you can't tolerate this at all, again, you might need an intervention like a PICL or posterior injection. Now, if you can tolerate something like a towel test and you don't have a CBP provider close, they're all over the place, so look on that website. But if you can't find one, then you might be able to graduate to some of the devices that are available online to increase your curve at home. Posture at this level is mostly working with groups like Healthy Posture Club or Agoscu. These are online programs where you can, from the comfort of your home, work with a therapist, and they can give you exercises to do in order to try and improve your head over your body. Because if you don't have normal posture, you're putting more pressure on that irritated upper cervical spine. Now again, if you can't tolerate stuff like this, you might need an intervention like a posterior injection or a PICL. So in summary, if you're limited because of CCI, there are things that can help. You can rehab out of this. Now, if you can't, you might need help like a posterior injection or a PICL. But realize rehab is going to take a while from this level in order to climb out of that hole, if you will. If anything here makes you worse, then stop. And when you can't advance your rehab, that's when, again, those orthobiologic interventions can come in. And then finally, again, like, comment, share, and subscribe. I know this is a deep dive video. You may have been directed towards this, or maybe you just found it, but if you want to pay it forward to the CCI community, do these things so more patients like you can find these videos. Thanks so much for watching, and have a great day.